guys, today we're going to talk about how to properly stretch your hip flexor muscles, so your iliopsoas, along with your quad, and both the proximal, so the top portion, and the distal, or the bottom portion closer to your knee. We're also going to chat a little bit on how to stretch out those inner thigh muscles, those groin or adductor muscles, really just trying to keep the front of the hip capsules nice and healthy and happy, and preventing any pinching that you may be experiencing anytime you're sitting, driving, out there cycling or running, okay? So first thing we're going to get into is the proper way to do a hip flexor stretch, or sometimes known as a couch stretch. We're going to break it into two parts. So first part is we're going to attack the front proximal portion of the quad, also those iliopsoas muscles. We're going to get into a split stance position. If you're wanting to stretch the right hip, right leg is going to be back, okay? And what I'm going to do here, I'm not going to drop a whole lot down towards the ground. What I'm really going to focus on is taking my pelvis, and I'm going to be tucking my pelvis under. So essentially we're going to pretend like our pelvis is a bucket of water, and the water we want to follow the backside. So a little bit of a tuck, okay? A little bit of a knee bend is totally fine too. So hanging out here for at least 30 seconds. If we have the space on the ground, we want to get a little bit more aggressive. We're going to drop it down, still getting into that split stance position. Step number one, we're still going to get into that hip tuck, that pelvic tilt backwards or posteriorly. And we can just hang out here. This is totally fine. Big things I have my patients focus on is we really want to avoid any type of extra stress into that SI joint or the lumbosacral spine, which is often created when people try to get even more aggressive into this position, and that you'll see them shifting their pelvis forward and then even starting to arch their back or tilt away, trying to get more of a hip flexor stretch. The problem with that is you really start to ride into the spine and get a lot of that lumbar extension. We don't really want that. So you want to keep it really stacked, really tall, head over shoulder, over hips, over knee, a little bit of that butt tuck, okay? If we want to get a little bit more aggressive with the distal portion of that quad, that's when we're going to grab a yoga block, books, pillows, whatever. A couch is great too if you have the tissue length to support that. What I commonly see people doing incorrectly is when we're in that couch stretch, we'll try to do this, there's a lot of knee flexion. But what can happen is if you don't have that tissue length between the knee and the top of the pelvis, when you really start to flex that knee, you're going to get into a position that feels really uncomfortable, and people's go-to positions is that they start to hinge at that hip right here. So you're actually slacking the muscle tissue here at the top portion of that insertion point or origination, and really you're doing yourself a disservice. You think you're stretching it, you're not really. So what I would encourage people to do is drop that angle of the knee, go a little bit lower with that knee flexion, but still really focus on being tall, pelvic tilt, and as you get that tissue length, then you can start to get into more of that knee flexion, okay? Last thing we're going to talk about is going to be how to stretch your groin. The groin is made up of sort of a front portion, a medial portion, and a posterior portion. A bunch of different muscles help to actually make up this groin group. So I like to have my patients start in this position where we sit our hips back, and from here, when we're in this hips back position, you're going to feel a stretch a little bit more in that backside, in that adductor magnus, which sometimes acts as a hamstring muscle. Toes are up, and as I bring myself stacked over my knee, I'm trying to keep my pelvis nice and straight. I'm not doing a lot of rotation here. And when I do this, I'm going to start to feel it a little bit more in that medial group, right in like the gracilis, adductor, longus, and brevis. And when I want to continue doing this to really try to get that front portion of the hip, I'm actually going to start to begin to let my toes kind of point towards you, forward, and I'm going to let my hips sort of rotate away from my straight leg. So you are going to get maybe a little bit of a hip flexor stretch, potentially, but it's actually going to target that pectineus muscle too, okay? So hanging out here, slowly moving, maybe 10, 20 seconds, and then you're going to start to do the opposite. You're going to start to shift back, plant those hands, sit the hips back, again, getting a little bit more of that deep posterior adductor magnus stretch, okay?